everyone! Welcome back to my YouTube channel. This is Dr. Gaile, and whether it's about dermatology or sharing a piece of my personal world, I'm here to bring authenticity and knowledge straight to you. So, for today's video, I have a very, very special guest, one of my good friends and fellow content creators, also a dermatologist, Dr. Erin Tababa-Santos. So, I won't do too much introduction because I want her to invite you guys kasi very active din si Dr. Erin in debunking myths, giving you a lot of information online. So, I will let her invite you guys.
Hi everyone! I am Dr. Erin Tababa-Santos, also known as the Nerdy Derma. So basically what I want to do or what I enjoy doing on the internet is I try to put context. So dun sa mga skincare practices kasi, hindi siya like hard and fast na bawal or pwede. So there's always the middle ground na personalized for you. So I'm very excited for our topic.
Actually, guys, just a little bit of background. Si Dr. Erin, before ko siya na-meet na in person, matagal na kami nag-uusap online.
Yes.
And isa talaga siya sa mga nag-inspire sa akin to actually be out there. Oh, it's true, it's
Pero
true though.
galing mo!
Kasi si Dr. Erin, parang Twitter ka nag-start, no? Oh, and then, biglang, yon when I started on Instagram, ang dami ko tinatanong sa kanya. And she's been very helpful. So, ayan, finally, now that everything is almost back to normal, actually parang back to normal na, no?
Yes.
And face-to-face na, I now have the opportunity to actually do a collab with her. So, we're very lucky, actually.
No. Actually, in terms of like video, takot ako sa video format. Kasi sa tweets, madaling mag-edit eh. Pag video, parang, pag mali, okay, stop. Kaya
sa bagay.
idol ko doon si Doc Gaile. Ang galing
And then ngayon, ano na, collab, tsaka mix-mix. Hindi, actually,
Mekos. Ayun.
Mekos. Nakikita ko yung mga tao nila, pinipigilan, pigil. Actually, very interesting yung topic natin today, and we were brainstorming a little bit about it. We were talking about ano ba yung pwedeng pag-usapan na interesting na bago. So, naisip namin, ako since I'm from the province, growing up, marami akong mga beliefs about skincare na kinalakihan ko. And now that I'm a dermatologist, I want to discuss all of these, or hindi naman all, the common ones with Dr. Erin. And ito guys, surprise to ha. Like, kahit
walang preparation.
Oo, hindi niya din alam. And maybe Dr. Erin can also share some of the beliefs that she grew up knowing. Let's start with one very common one, Dr. Erin.
Yung first natin.
Calamansi, used as a natural skin whitener.
Yes, actually, ginawa ko to. Yeah, buti na lang. Hindi kasi pag morena, it's more common actually na you really have areas which are darker than the others. But it doesn't mean na problematic siya.
Yes.
Ano lang talaga, yun yung normal for our skin type. So when I was younger, I think high school, syempre yung calamansi, tapos papahid mo siyang ganon. Kasi ang theory is yung calamansi, meron siyang vitamin C, and vitamin C whitens. So ano nangyari?
Ano nangyari sa kilikili?
Niswerte naman ako, hindi naman ako nasunog. But vitamin C, if properly formulated, it can help brighten the skin tone, but not in yung calamansi juice na form. Kasi it can actually irritate the very, very sensitive skin of your kilikili.
Kasi acidic din siya.
Yes, and once ma-irritate siya, you can actually develop more darkening. So, I don't recommend, but it's very widespread.
Oo. And I read somewhere that calamansi is also photo...
Photo contact.
Ayun, kasi hindi parang, ano yung tawag din sa nag-react siya pag natumatama yung sun sa skin when you have calamansi. Sabi nakalimutan ko, gutom na tao guys,
Dermatitis.
Oh, pero what do you call that? Photosensitive.
Yes.
Yeah. So, it makes your skin photosensitive pag naglagay ka ng calamansi and naarawan ka. So, that's another thing. Ako naman, iba yung tinuro sa akin. Pagpawisin daw yung paa mo, lagyan mo daw ng calamansi. Tapos, mawawala daw siya. Actually, hindi calamansi yun eh.
Ano? So, share mo sa kanila.
No, when I was younger, kasi I had hyperhidrosis, or yung tinatawag natin nagpapawis na paa at saka kamay. And yung sa mga caregivers ng lola ko at that time, sabi niya, ay naku iha, napakadali niyang gamutin. Yung pee. Pinasasabi ko pa, di ba? Yung pee daw. So, pag naliligo ka, para mag-pee ka doon sa feet mo, ibabad mo. Kasi the ammonia daw there, supposedly. Pero hindi naman nagkatotoo. Hindi nag-work.
Alright. Ang gusto mo kasing function is either, so yung sweat glands mo, pwede mo siya isipin like hose, parang yung sa gumagawa ng pawis papunta sa surface ng skin. So, either you stop mo yung source or yung kung saan lalabas yung water, ipablock mo siya. So, yung wee-wee, hindi niya kayang gawin yon. So, we do have antiperspirants which can do it temporarily, or you have like toxins which can
Paralyze
the sweat production. So we will not do that. Very
Yes.
interesting, no?
Oo.
Widespread siya pero
Tsaka ginawa ko din yun. Yung bata pa ako, ano ba naman alam ko, diba?
yes. So
Ito, actually, may nagtanong pa lang nito sa akin last week, Dr. Erin.
Erin lang.
Ay, oo nga pala. Oh. May nagtanong sa akin nito last week, yung rice water. Okay, so rice water used as a toner mist for a brightening effect.
Although may mga products na ganyan ngayon. So
yes,
rice water,
actually.
ito ba yung
Hindi. Okay.
Ay,
So,
oo.
nalaman ko lang din yan kanina.
Paano siya?
Alam natin yung di ba? Yung parang,
Yung
after mo
niluto,
magluto, yung tubig.
Yung malabnaw.
Yes, yung
Yes,
parang bago siya fully maluto, yung tubig dun sa
bigas.
taas. Oo. Apparently, rice water is used to wash the water before mo siya lutuin.
Yung pang sinigang.
Ay, sorry, hindi kasi ako nagluluto, guys. So, yung asawa yung nagluluto.
Nagluluto, yun, pang
Tignan mo na,
sinigang.
bakit may rice water yung sinigang?
Yun, di ba yun, yung pinaghugasan mo ng bigas? Yun yung...
Oh, hindi ko alam yun. Tubig lang yung ginagamit.
Sinigang nga ba? Sinigang nga, sinigang.
Sige, dahil hindi ako nagluluto, naniniwala ako sa kanya.
So yun, yung pinagbanlawan.
Daw.
Pang ilan? Kasi maraming banlaw.
Ay,
pang ilan?
napaka-scientific talaga.
Diba? Meron yung unang banlaw, yung second na banlaw.
Tsaka paano kung galing sa lupa yung rice? Di may putik na yun.
Yung pinagpagpaganyan. Yes, di ba dirty siya? Kaya
Hindi, pero hindi ko alam I don't know the concept behind it. And I could be wrong. I could be wrong. You can correct us. But ako, all of these products naman, if properly formulated, like what Erin said, and, there are certain cultures that use talaga rice water. Ako, I'm not against it. And I've known of some people na gumamit niyan. And okay naman yung
It's
effect
quite
niya.
popular pati, no? Ngayon, kasi parang ang misconception, you have to have studies para masabi na effective yung isang bagay. But in truth, yung mga products na nakikita natin sa market, actually, a very small amount lang sa kanila yung actually tested.
Yes.
So usually what happens is may ingredient and the ingredient is proven to work and it's incorporated dun sa product mo. So for example, yung rice water, kahit wala siyang studies, it doesn't automatically mean na hindi siya effective.
Yes.
Which is something I unlearned along the way. Kasi dati parang rice water,
As
yan.
doctors kasi we were taught na parang everything, as in everything, has to be clinical, based
Proven.
or parang evidence-based,
Yes.
may clinical trials. But you're right, kasi certain products like cosmeceuticals, parang hindi naman
siya talaga like may clinical trial to test it. So for example, like yung snail, di ba? Ang snail mucin, may effect naman siya. Pero in terms of trials, hindi ko nga alam kung may trials ang snail eh.
Hindi ko din alam. I also know.
Very, very interesting.
Yes. At saka ngayon, parang ang dami-dami na talaga eh. Ako, I don't like to invalidate my patients' experiences. If they say na parang, I feel good, my skin feels good while using this product, by all means, use it,
hindi
diba?
harmful.
Yes.
Yun yung what I did before na parang, hindi effective yan. Tapos the patient feels na hindi ka nakinig. Whereas if you build on kung ano yung gusto nilang routine, you actually encourage them to do better in terms of yung sa skincare nila.
Kasi pag pumangit pa yung skin nila, hindi kasalanan mo pa. Diba?
Tsaka gaganahan sila pag yun na yung routine na gamit nila.
Yes. Ito yung very interesting kasi ito na-witness ko talaga. Ito ginagawa ng mga...
ito?
Yung ito, tutulong ko sa... Yeah.
Ay!
Ayan. I'm sure nakita mo din yan.
Baka yung mga watchers natin.
Kasi ako, like I said, di ba, I grew up in the province. So, medyo limited lang yung choices ng mga tao doon before. Before ha, ngayon syempre hindi na. With what you can use on your skin, ganyan. So, may mga kasama namin sa bahay before. Bibili sila ng Astringent. Tapos bibili sila ng antibiotic tablet. Dinidikdik nila. Tapos nilalagay nila yon. Specifically, Clindamycin.
Ibubukas nila yun.
Or pag capsule, bubuksan nila, ilalagay nila doon. What can you say about that, Doc Erin?
It's very rampant. Tapos pag meron things kasi na superficially, parang, it makes sense. So nga, yung antibiotic mo, ihahalo mo dun sa astringent mo and then you put it on the, for example, the face.
Acne. Usually acne eh.
Kasi di ba may mga ganun, antibiotic toners ka naman. So, gumawa ka na lang din. But, of course, hindi siya meant kasi to go that route. So, may version ka na iniinom and may version ka na ina-apply.
May tinatawag sa tayong bioavailability. So, hindi naman ibig sabihin nun, yung ininom mo effective, pag pinahid mo effective din siya. Same with vitamin C, di ba?
Yes.
We always talk about it. Oral vitamin C is very different than topical vitamin C. And speaking of, yung pinag-uusapan natin na antibiotic, ginagamit din siya sa mga sugat.
Nakakakita na rin ako pag papasok yung patient, tapos may
puti.
White sa sugat. So, hindi siya intended to do that. And another thing is focus siya ng infection.
Yes.
So, siguro ang pwede nating advice sa watchers is Yun, so pwede tayong mag-segue sa sugat kasi sobrang daming myths in terms of sugat.
Actually, pwede tayong mag-ng sugat video.
Yes!
Puro sugat lang. Kasi sugat.
Yun, so ang most common na na-encounter ko is hindi nila hinuhugasan.
Yes.
Kasi natatakot. So, ngayon, we will correct that. We don't put yung antibiotic na capsule and we also wash our wounds. Huwag kayong matakot na...
Soap and water.
Yes, huwag kayong matakot. Hindi natin gagamitin ang
agua oxinada, mertiolate, or betadine.
betadine. Kasi yun yung
Uy,
mga
dati
old.
nagkaroon ako noon. Dati pa nagagasgas ako, nilalagyan ako ng mertiolate.
Yung pink?
Yes.
Pero at least...
Sobrang hapdi.
Hindi ba? Di ba mercury?
Actually, I don't. Pero buhay pa naman ako, guys. I mean, hi.
Yun. So, kasi yun yung traditional na cleansers. But the problem with that is it kills even your healthy skin cells. So, pati yung kailangan na, yung buhay na balat, nadadamay siya. So, just soap and water. Yes.
And dati, growing up, di ba sabi nila, wag daw takpan yung wound.
Para makahinga.
Para matuyo at para makahinga.
Yes.
So, yun, I had to unlearn that, ha? I had to unlearn that. Kasi naalala ko nung second year resident ako. Kasi sa province nga ganun eh. Parang, kailangan matuyo yung sugat. Kailangan open para makahinga, ganyan.
Yung maglalangib.
Yes.
Yes. Yun.
And then I had to unlearn that. Kasi nung nag-attend ako ng conference on wound healing, moist wounds actually heal faster. Kasi you provide an environment for healthy cells.
May favorite analogy ako dyan. So, sa patients, takot na takot silang mag-lotion. I tell my patients, the skin cells, they're like snails. So, yung snails, pag moist yung lupa, madali silang mag-crawl. So, for example, you protect your wound, magaling silang mag-crawl. But if it's very dry, like in a desert, imagine mo yung snail mo nasa
dehydrated, tuyot na tuyot yung snails
sila. So, hindi mag-heal yung wound mo. So, yung sa moistness, it's something I unlearned din. Kasi nakakatakot, di ba? Parang counterintuitive.
Kasi parang feeling nila, ako at least dati feeling ko, pag walang scab, parang hindi siya gumagaling.
Nakakaharang pala siya sa pag-close ng wound. So, yun, yung mga langib, tsaka wag nating kutkutin.
Yun, diba? Alam mo, yun na nga, parang, yung isa pang gusto ko i-emphasize is, even now, na Erin and I are like years into our practice, we still continue to learn new things.
Yes.
And from each other and from everyone. And ako, whenever there's something new, I'm not even afraid to even question what I already know. Kasi bago talaga yung new information comes, ganyan. And that's actually our advocate as content creators. We want to educate, we want to continue learning even from you guys. So, kung meron kayong alam, tapos may mga pinagsasabi kami dito na mali, we're open to, hear about it in the comments below, di ba?
Yes.
Hindi kami madaling ma-offend, hindi kami sensitive.
Tsaka, hindi mali to say something na ito yung alam ko before, and we're giving you information na, okay, ito na pala yung bago. So, yung previous version was luma na.
Kasi yun yung based dun sa mga alam nila nung panahon na yun.
Yeah.
Diba?
So, kung, di ba sa patients, pupunta sila parang, Dok, na-guilty ako kasi ginawa ko yan. Pero sasabihin natin is, yun nga yung point. Kaya ka nagpapakonsult. Kasi we teach you how
hindi
to do it.
Hindi ka namin papagalitan, promise. Mabait kami.
Siya. Strict ako, tsaka sumasungit ako. Yun lang. Pero, ano na natin nadaan?
Oo, pero marami pa nga ito. Ito gusto ko to. Kasi ito, na-witness ko din to. Nail cutter or nail clipper to remove kulugo or wart.
Very, very rampant. Kasi masarap di ba? Pag
hindi siya masakit pag ano daw. Kasi nakita ko na yan before. Hindi lang yun, nail cutter, nail clipper, sinusunog pa. Tapos yung candle
sigarilyo.
wax. Ayun. Sigarilyo. Hindi ko pa nakita yun, but
sigarilyo, may patient na.
Kasi yung kulugo kasi, if you look at it up close, meron siyang, we call it thrombosed capillaries. Parang meron siyang mga pula-pula. Yun yung target nila. So, what can you say about that, Erin?
Nako, we don't want to do that. Kasi yung kulugo, virus siya. And if you, kumari, maliit yung kulugo mo, tapos ninipper mo siya, mahagip mo yung katabing skin. So, basically, parang nag-implant ka ng wart na virus dun sa adjacent na skin, you can end up making your kulugo bigger.
So, paano kung ginamit ng kapatid mo or kamag-anak mo yung nipper? Parang binigyan mo siya ng free kulugo.
Oo.
Mahahawa mo pa.
Oo nga. Tapos ang problema kasi pag malalim dito, sobrang niyang hirap tanggalin. Litid na po yung nasa ilalim nito. Wala na to. Parang balat. Tapos, di ba? Balat, litid na yung underneath. So, very, very difficult.
Imagine kayo sasabi ni Erin, parang,
tas ang panakot ko sa patient, sige kapag ninipper mo, pumunta sa ilalim ng kuko, pati kuko mo, tatanggalin muna bago matanggal yung kulugo. So,
and we always also tell patients na sometimes, nagre-resolve siya on its own. Kasi yung body natin, we're able to fight naman viruses eh. Kaya lang yun, minsan matagal. And sinasabi ko sa patients, especially pag kids, if it's there for more than a year na lumalaki, doon lang natin i-treat. But we wanna give our bodies, you know, a chance to fight off the virus. So, tsaka traumatic din eh.
Kapag nag-cautery, masakit siya at may sakit tanggalin.
Nagkaroon na ako before dito, Erin.
Alam mo, feeling ko may genetic,
yes, meron.
Disposition.
Yes,
Kasi
because
patients na ang dami.
and then we touch Kulugos all the time and we don't really get it. So, yeah.
Wala na.
Ang ginawa ko doon, tinisi ko na 90%.
Yun, pinil niya. Pero pag
don't
magpipil kayo,
try this at home, ha?
Yun, under your doctor's
Derma
supervision.
Ay, ito sinabi mo kanina.
This one, always tong tanong or biro ng patient. So, Doc, alam niyo yung mga sabit-sabit dito, yung mga
Yung mga tinatawag nilang warts.
Warts,
Diba?
pero yung may
Hindi naman
tangkay. So, pwede ba naming talian ng buhok yun? So, ang
hirap nun
tatalian yun.
Ano mo tatalian?
Hindi ko alam bakit buhok eh. Kung pwede naman.
Sinulid lang.
Sinulid naman. Pero, yun, mga
alam mo gagawin yun pag sobrang liit? Kailangan malinaw yung mata mo.
Pero technically, mag-work siya. Kasi kung ito yung pinaka-skin tag mo, masasakal mo siya eh. So pag nasakal mo siya, mamamatay siya, malalaglag siya.
But so siguro yun yung nun.
Yun yung pathophysician niya.
Pero bakit buhok?
Para effective. Hindi ko alam. I mean, effective siya, pero kasi pag nagsugat yun, hindi maganda yung wound. At saka, paano pag nag-infect yun yung nakakatakot?
So, you don't know kung anong, di ba, paano kung nasakal mo yung buong skin around that area, hindi lang yung
malaki yung mahahagip.
And because there are other effective and easier means of doing that.
Yes. So, hindi ka mag-scar or
So, imagine mo, tatalian mo isa-isa yun. Oh my God. May mga buhok ka na, naglalakad ka, puro buhok ka nila.
Di ba pag ano pa naman yun?
Hindi naman siya instant, di ba?
Hindi, kailangan mo hintayin malaglag. Or mabulok.
Yeah.
Diba? So,
oh my God.
Wag na lang patanggal nyo lang. Mabilis lang yun. Sangganan lang.
Ito, let's do this. Ito.
Sige. Yeah. Pero hindi ko pa siya narinig. Although very interesting na.
Ako naman actually, okay, yung na-receive namin is garlic for dog bites. So, I think siguro used as an antiseptic or what. Pero alam mo yung narinig ko, Erin? Yung garlic daw, pag may lagnat ka, ilagay mo sa kilikili mo.
Di ba pampalagnat yun?
Ay,
pampalagnat yun. Di ba
bakit mo gusto malagnat?
Kung hindi ka papasok.
Hindi ko alam.
Yun yung alam ko.
Baka yun yung alam ko. Pero basta garlic and lagnat, parang na-connect ko sila. Growing up parang
narinig ko
bakit siya nakakalagnat? Kasi mainit.
Siguro.
So lalagyan mo ng garlic yung kilikili mo, tapos magta-temperature ka.
Baka
tapos mainit siya.
Siguro nasunog na gawa ng bawang, no?
Actually, alam mo, yung mga Filipinos tayo, we're very conscious about our underarms. Just, it's a good thing kasi, di ba, we want it always clean and white and good smelling. Ganon.
So, in terms of sa dog bite, siguro best is pumunta ka muna sa...
Oo, definitely.
You wash it first and then you go to hospital.
Bite center.
Bite center.
Kasi lalo na pag unprovoked yung bite sa'yo. Teka lang, ibang usapan din na derma to
lampas na sa amin yun. So, pero in terms of like... Consult kayo
ER.
and get injections.
Ayan, ito Dr. Erin, last na to. Okay, yung mga sinasabi namin dito, hindi naman namin siya lahat kino-contradict because other things are good naman, di ba? Like we talked about yung rice water, okay naman siya. Ito, very, very popular to. And until now, ang dami-dami pa nagtatanong sa akin ito, yung papaya and papaya soap. Does it help whiten and exfoliate the skin?
Kailangan ko i-review kasi yung in terms of ano yung specific. Sometimes kasi they declare as papaya soap. But meron
kojic talaga siya.
Kojic, glutathione, ano pa ba? Vitamin C. So, depende dun sa laman na ingredient ng soap. But in terms, kung gusto mo kasing magpa-whiten, for me, baka mas effective if leave-on. Kasi kung sabon,
in cream form.
kung sabon, baka mabanlaw agad. But, parang, it makes sense.
Yung nare-remember ko yung papain, which is found in papaya, it can also exfoliate, di ba?
Di ba meat tenderizer yun?
Nagluluto
kasi
siya.
ako.
So ako pero di ka naman talaga alam.
Yes!
Pero sige.
Tenderizer siya. So siguro kung nakaka-tenderize, enzyme yun enzyme siya.
Pero yun it doesn't mean na parang exfoliate ka, puputi ka. But, syempre kung medyo dark yung skin mo, when you remove all the old skin na may pigmentation, pwede mag-lighten yung skin mo. But,
lighten or brighten? Favorite ko yun. Yung term ng bright. Kasi kung kung rough yung balat mo, hindi siya makaka-reflect ng light. So, yun yung dull na appearance. Whereas, kahit morena ka, tapos if yung surface niya is smooth, it's plump, di ba pag nag-moisturize ka, o you exfoliate properly, hindi yung over-exfoliated, it becomes smooth, so it reflects light, so yun yung nagiging bright.
Yes, totoo.
So, may sense siya.
Yeah, and when it comes to brightening and lightening the skin, ako for me talaga sunscreen pa rin. Kasi it doesn't matter what you're using on your skin. Kung bilad ka naman ng bilad sa araw, syempre nasa-stimulate yung melanin mo, di ba? So itim ka pa rin.
Yes, agree.
Wow. Ang dami natin pinag-usapan. Parang nadaanan na natin lahat, Erin.
Ang galing. I love it. Tsaka maganda na-review.
Yes. Like, kasi for me, I think it's important to address these things. And like I said nga, there might be a lot more that, we weren't able to talk
baka they
about.
can share yung any myths that they want to discuss. Kasi maganda siyang pag-usapan. Hindi lang basta, hindi.
Wala. Hirap kasi noon parang sabihin mo sa patient mo, hindi, bawal yan. Tama na. Oo, di ba?
Yeah, so wonderful.
Okay, yeah. So, thank you talaga for guesting in this YouTube show.
Me.
Show talaga. Sorry,
Thank you for having me.
Sorry, naging show na. Sorry, thank you, Erin, for being part of my YouTube channel.
Thank you so much.
This is first of many like this pa. I mean, you can always come back. Diba? Sabi ko sa akin, pag gusto niyong guest si Erin, kasi ano naman to she's also into, giving the right information. So, yun na, we're done. Would you like to add anything more, Erin?
So far, so good. Thank you so much. I hope na pakinggan niyo lahat, and if may additional questions kayo, just message it or comment it below.
Yeah. So guys, if you've enjoyed this video and want to stay updated on all things skincare, personal stories, and more, don't forget to hit that subscribe button and turn on notifications. So Erin, we are on our way to reaching 100,000 subscribers. So please guys, comment below any thoughts or topics you'd love me to do, or kung sino man yung mga gusto nyong guests na gawin natin next. So this is just the beginning, and together we'll explore so much more. Until next time, and see you again in the next video.